guys. James Waddell here. Hey, thanks for joining us again. Interesting topic this time around. You haven't heard us talk much about healthcare and innovations that we're bringing to that market, somewhat purposefully. We've been keeping those items somewhat under wraps, especially since the pandemic has hit, and there's been so much, I would say, turmoil, almost want to say chaos in the healthcare market. You know, one of the things that we wanted to focus on today is this notion of hospitals losing money during the pandemic, and somewhat expected during the pandemic. You might imagine with all the chaos and the unexpected or unintended consequences of such a pandemic hitting us. But really, what we found in our research is those costs, even after the pandemic, where we are now, have not came back under control. So the healthcare industry in general is looking for ways to be more efficient with their capital spend without taking away from the patient experience. So today we have three, I think, very unique approaches that could be used or should be looked at from a cost reduction strategy perspective. And there are also three items, three approaches that are most often overlooked from a healthcare perspective. And today, that could be very valuable in terms of being able to reduce costs from a healthcare provider perspective. And one of the things that I thought was incredibly powerful is looking at where the largest increase in health expenditures were from a patient perspective, but really from any dimension, any data set dimension. What our research showed, and this is a little bit of an older slide from the American Hospital Association, shows that drug costs is by and large the largest increase in expenditures from a healthcare perspective. And to help us sort of uncover why that is and maybe how to get that expenditure back under control is Annette. Annette, if you don't mind, could you please introduce yourself to the audience and give a little background on yourself?
Thanks, James. I'm Annette Hastings. I am with GlideNet Healthcare, have been in the hospital administration industry for a long time and understand the challenges and the opportunities for organizations to try to get their financial picture in alignment, considering how many big organizations are challenged with rising costs, shrinking labor, and need opportunities to do things differently in their cost structure to improve their bottom line. And in speaking about drugs, we're not so much talking about the direct provision of medications to hospitalized patients and ambulatory patients, but rather we're talking about prescription benefits for hospital staff. If you look at the overall benefits model for employees in a hospital, aside from taxes and the normal federal and state requirements of payment, the largest benefit cost to a hospital is within the medical benefits space. And what we're seeing is that typically the procedure-based care and the surgical-based care, though it is increasing in cost, it is by far overshadowed by the rising drug costs. So that when you're seeing a 2 to 3% cost in treatment, non-medication treatment and surgical procedures, you're seeing tenfold of that in drug costs. So that what we're looking at is opportunities for organizations to evaluate their prescription, they call them pharmacy benefit management programs, to ensure that the PBM, as it's called for short, is appropriately managing drug spend amongst the employee base. And what we do is we work with a team of providers who work with staff who are being prescribed medications to ensure that between our provider, the physician treating the patient, the individual, the employee, and the employee themselves, that they're aligned on best drug for best price. We're not looking in our efforts. We're looking at a way to ensure maximum intervention is done and that care is provided, but it doesn't necessarily have to be the highest cost drug that's out there in the marketplace. So that's one aspect of the medical benefits program that we work with organizations to try and get costs ratcheted down. And we've had some great success in this area. Other areas within the medical benefits space is really evaluating, and without as significant an impact, the drug pharmacy benefits management program really does have the highest financial gain for hospitals. But we also look at ensuring that we've got providers who are working with employees to ensure that the therapeutic programs that they're being offered are the right ones and are being prescribed appropriately and are at the best efficient care for the employee. So that even though pharmacy benefits is the number one area, we are also working in other areas. We work in dependent verification, where we go through the list of employees that are being covered by medical benefits and ensuring that their dependents are still allowed to be on their programs. So we look at age and relationship and all of that to identify that the right people are being covered by the insurance plan. And we also look at other supplemental coverages, so that there's a number of different areas within the medical benefits space that you can explore avenues of improving efficiency and improving the bottom line. By far, the pharmaceutical benefits side is the most advantageous as far as bringing in a largest return on investment.
Wow, there's a lot of really good information there. I don't even know where to begin. In terms of auditing, in my words, right, auditing your benefits program, is that something that a lot of providers and even just companies in general often overlook? I would imagine that it is.
I think it's been easy to allow the pharmacy benefits management company to handle it for you. You'll find that CVS, for example, is a pharmacy benefits manager. And frankly, you're almost allowing the fox to mind the hen house to a certain degree. It never hurts. And if you work with the right company to do the work, and you base it on contingency, you have no opportunity of losing anything, because if the company that's working with you is only going to basically take a fee on savings, it doesn't hurt to kick the tires on it. It's something that some companies do every 3 years, some companies never do. They hire their PBM and they keep them forever. But it's wise to look at everything in your organization to ensure that you're doing it the best, most economically feasible way. So do they do it? Some do, some don't.
Okay. Very good. Annette, thank you. I'm going to bring you back in just a second. I'm going to move you off to the green room right now. Enjoy. Annette, having heard Annette, I was reminded of in my world. You guys know me. In my world, the built environment, where we're looking to optimize. Typically, you've heard me talk about corporate real estate, but I was reminded of continuous commissioning, and then around sustainability, as I heard about this auditing of those employee benefits. That's the parallel that I would bring in my experience. So that word sustainability stuck with me a little bit. And I think it's a good segue. It is a good segue, in fact. Talk about our next guest speaker. They'll be talking about managed print services uh, and um, and their ability, if it's under control, and when you have it under control, to reduce operational costs, really for everyone, but probably more specifically in the healthcare environment. So with that, let me introduce Bob. Bob, how we doing?
Pretty good. How you doing, James?
I'm good. Would you mind introducing yourself to the audience, sir?
Yep. My name is Bob Hagan. I am a regional director for Lexmark's enterprise accounts. I'm based in the Southeast. And, I manage about 150 accounts with a team of 10 people. But about 20% of them, 25% of them are healthcare accounts. And what's very unique to my background is I'm not a clinician. I never worked in a hospital. I have almost 25 years of experience inside the copier, printer, and managed print services environment. But about 15 years ago, working for another company, they asked me to manage their healthcare team. And I said, hey, how hard can that be? Quickly found out that it was pretty difficult. Didn't know the lingo, didn't know the environment. And I asked to be sent back to school. So to bundle my MBA, I have a health administration degree as well, just to understand the world inside of healthcare, because I truly believe it's a unique vertical, and you need to come in there with an understanding of the challenges facing clinicians or back office people who are delivering care to patients. It's a whole different world than a commercial environment. So I think I bring a very, very unique perspective to this conversation.
Certainly. Help me understand managed print services and the items that you guys bring to healthcare, particularly as it relates to reducing capital expenditures or operational costs.
Well, I think with all the explosion of EMRs, you see Cerner and Epic out there. HIMSS is next week. They're huge sponsors of that. And everyone's talking about this paperless healthcare facility. And that just isn't playing out the way that we've been taught or educated on how it would work. We're seeing volumes inside of healthcare in unmanaged environments actually increasing instead of decreasing when they implement or expand their EMR. And to have a structured strategy around that environment, pays dividends, not just to the healthcare organization or the system, but actually the clinicians, the doctors, the nurses, as well as the patients, right? Unless you have a very good managed environment, you really can't admit people until you discharge people. And so if a system is down and you can't print discharge orders, getting that person out the door is a problem, because you have someone waiting on the front end of it to come into the system being admitted. So having a structured strategy, which we call a output framework for our customers, is what we believe is a differentiation in the market. You look at an organization, you look at, the different environments. We call them swim lanes. So you have healthcare, hospitals, acute facilities, ambulatory, maybe some back office locations. And how you look at those is completely different. And then you look at different areas of that, the type of device, the right device in the right location. How do you care and feed for that device? And then finally, what can you do to maximize your investment in that device to take paper out? It's interesting. You put sustainability right in front of us here today from managed print services. And hey, we like when people use toner. We really do. Mm-hmm. But to do the service, the right service and right value for our customers, we have to help them take pages out. And in the sustainability equation, the biggest influence on your strategy for sustainability is the paper usage. Manufacturing, creating, and delivering paper is the biggest, I guess the worst piece of the sustainability model inside printers and copiers. It's the paper. And we truly try to help customers take that paper out of their business.
Is it appropriate for you to, I think it is, to provide the audience with a little bit of insight into the approach that you might take? It sounded like there's professional services that you provide to the clients, right? To help them understand how they might be able to go paperless. I would have never thought Lexmark would have been doing that. But to me, that's an amazing, valuable piece of professional services.
Yeah. If you think about the legacy of Lexmark, we're an IBM spinoff in the early 90s. And when that happened, we hired consultants to get us up to speed. What should we be doing? What should we be doing differently? And they said really to focus on verticals. And so healthcare is one of our very important verticals. And what we do in there is we make sure we have people on our staff, ex-healthcare people. So we have a person who was a CIO at a hospital. We have a person who ran the VP of IT at another hospital, who actually help and coach our consultants before they go into organizations to understand what they should be looking at. And so I mentioned that output strategy. And before we do anything, we want to understand what's going on in that environment. What kind of devices, what kind of workflow, how far do people walk between devices? Do they need color? Don't they need color? What kind of solutions do they need? Do they want, a fax server? How do we help organizations become more efficient around a document, whether it be hard copy or a digital document? And it all starts with that assessment process. And we do that assessment process before we go in and through the life of the agreement. We have something called a governance program that's pretty rigid with our customers. We meet every 30 days to talk about tactical ideas or concepts to go after to reduce cost, to reduce paper output. And then we monitor that. Like I said, IBM spinoff, we have a bunch of engineers. We manufacture our own devices. So we own our own technology. And with that, we have a ton of sensor data that we capture from our devices. And globally, we have one single system that we're able to mine that data from and compare that amongst other organizations, and in this case, other healthcare systems, to see where the best practices are. So we can bring those to the table and bring continuous improvement as the relationship, develops and continues.
Oh, Bob, you hit a point that gets me super excited. Unfortunately, we don't have time to dive into it. When we think about, from my perspective, when we think about cognitive building, cognitive workplace, it's utilizing sensors. A lot of times they're called IoT sensors, but they're just sensors in general that apply to automated solutions. It's not AI yet, right? Automated solutions. But we take that insight from all the data sets that we can. We take the data from all the systems that we can to generate insights to help inform what optimized looks like. And from a healthcare perspective, I think we're just starting down that road. And again, who would have started thinking, I'm going to call Lexmark and see what kind of great data sets they have. But there's really good data sets there. And you guys really need to be out there shouting that at the top of your lungs, and I'll help you.
We are. We have, we used to have we call it a global system that talked to our 1 million devices in the field. Now that it's about 1.2 million, and we have a single global system that we changed the name to IoT global system. And we're talking to all those devices about every 8 minutes, getting information off those 400 sensors, and we're running algorithms to actually predict the failure. So the end user, the clinician, nurse is never down. We can send a technician with the right part at the right time to fix the device before they even know it goes down. Huge differentiator in the market right now, and a huge, mind shift.
So there's definitely, just like Annette, there's an absolute need for a deeper dive. Annette, and we're going to bring her back on in a second, talking about her professional services for doing auditing of those benefits packages. From your perspective, it's not just sustainability around print and going digital. It's about utilization from a people perspective. How much effort do they have? And amazing stuff. Amazing stuff. So with that, as much as I want to continue on, this is a short introduction of things. I'm going to put you back in the green room for a second.
Bob's such a short name too, right? And next thing you know, 5 minutes later.
All righty, here we go. Putting you back in the green room for a second. I want to come back to this just for a spell. I'm not going to get really deep into this. When we think about what's happening in terms of healthcare, obviously, well, maybe not obviously, there's definitely a lot of construction and planned capital expenditure on reconstruction of healthcare facilities. That's very much needed in this country. We also do want to make sure that those facilities are maximizing the comfort of the patients and the perception of those patients of receiving high quality care, as well as the wellness of the patients in terms of well-being, access to lighting, noise control, all of that stuff. So what I'm about to say doesn't impact any of that. That is incredibly important, and there should be absolutely no taking away from those initiatives or those strategies in order to save money. And that ties into this notion or this statistic where 80% of the hospitals are conducting energy performance, safety, and sustainability audits. They should be doing that. And this cost reduction strategy isn't necessarily tied to that. So let's talk about what I mean by that. When we look at healthcare, and particularly the built environment and new construction, there are some firms and some practices, and I mean design firms or engineering firms, and I don't want to speak ill of anybody, right? There are firms that do it better than others. And by doing it better, I mean the engineering that they have, the amount of coordination that they're able to do, lends itself to the fact that the change orders can be reduced and the amount of rework for the construction process can be minimized. That is something that as a facility manager, as a project manager, someone responsible for capital expenditures, yes, you need to maintain your budget for those new healthcare facilities. You need to start performing the construction process, the design process, construction process, and commissioning process in a more optimized way. There is a better way to do it. There are firms like MEPIS out of Chicago who definitely excel at communicating, coordinating, and providing designs that minimize those change orders. There are firms that excel in bringing technology in to optimize the collaboration aspect of things. There are firms that specialize in pre-constructing the facility and bringing it in pre-constructed pieces and assembling it in order to minimize the amount of rework. So what I would want to leave you guys with, without getting really deep into engineering and construction and design of healthcare facilities, is if you are someone that's on the budget side, if you're a CFO, if you're responsible for capital expenditures, have a conversation with your teams as it relates to in your construction teams to see if they have strategic initiatives to drive out these types of practices, right? What's the continuous improvement process that your teams are employing with the design and construction communities to ensure that they're minimizing change orders, or that they're increasing system coordination so that you're minimizing the amount of rework that needs to happen? And the other thing that I heard, especially from a design perspective, is ensuring that you're giving, as a CFO from a healthcare provider perspective, that you're giving the design team as much data as you have access to. Again, I'm blown away by some of the data that Lexmark might be able to provide in order to help inform a better design, an optimized design from the healthcare perspective. With that, I'm going to bring Annette and Bob back in. Annette is back and Bob is back. I see Annette is first on my screen. Hello again, Annette.
Hello.
Annette, thank you very much for that great conversation around, in my words, auditing employee benefits as an effort to, I would think, increase satisfaction of your employees while driving out or decreasing the cost of benefits. So the question to you, Annette, would be, if there's one thing you'd want to leave the audience with from today's discussion, what would it be?
It would be that in these times, these economic times in healthcare, it pays to look at everything. I always say it's stuff over staff. You've been reading in online and in the papers that hospitals are reducing and cutting headcount. It's much easier to evaluate everything within the organization that is not labor related and try and drive costs out that way. Benefits is just one of those unsung categories that you can look at and save possibly millions at, which could save any number of jobs in an organization. There's so limited amount of time, but man, you're right. We never even touched on the fact that the first lever most everyone will pull from us, most CEOs would pull, is their fixed cost around labor, as opposed to looking at some of these other areas. And shame on us all for not standing up and saying, hey, let's make sure that we're more efficient before we start letting go of people. Right.
Amazing stuff. Thank you for that. Bob, back at you, buddy. What is the one thought that you'd want to leave this audience with today based on the discussion?
I think my one thought is probably three pieces, right? One, you got to know where you are, right? You got to know where you are today. And in my world, what are you spending? How many devices? What's your volume? All that good stuff. And then what do you want to get to? What's your vision? What's your goal? And then how to get there, and who's going to lead that way to that, that promised land, and how are you going to measure those pivotal or those monumental points along the way to see how your success is going. But I think it's where you are, you got to know it, and where do you want to get, and how are you going to get there, and is there a strategy around that?
Awesome, Bob. Completely agree, by the way. It's where are you today, where do you want to be, and how are you going to get there, right? And then there's the contextual experts you need to bring in to help you figure that out. Audience, on behalf of Annette and Bob, thank you very much for watching us live. If you're joining us live, you're most likely watching the recorded session. Thank you for that as well. Somewhere you will find, either in the comments or the video description, a link to our, Annette, Bob's, and myself's LinkedIn profile, where you can get in touch and ask for more detailed information. Thank you, everyone, again, presenters, audience. It was a great show. I'm going to end the broadcast now, and we look forward to talking to you again.
Thank you very much.